So hello and welcome everybody to our first webinar of the World GBC's Air in the Built Environment webinar series. Today's session is Indoor Air Quality, Lessons for the Future of Public Health. My name is Catriona Brady. I work for the World Green Building Council as head of our Better Places for People global project. And today's session is kindly co-hosted by our partners UL. So it's a wonderful pleasure for us to bring you all together to discuss this incredibly important topic. And our health within our buildings, and particularly the topic of indoor air quality and environmental quality, is a topic that we know we're particularly attuned to at the moment. And of course, none of us could have foreseen the changes that have transformed the way we're living at the moment through the coronavirus pandemic. And so in today's session, we'll be discussing this topic theoretically and academically, but also looking forwards to futures that we need to take forward in terms of lessons for public health. So we have participants joining us live and via recording from all over the world, and welcome to you all. It's a pleasure to be able to host you. Now, for those of you who joined us live and joined us a little early, you'll have seen there was a starter question on screen asking what percentage of time people think we spend inside buildings. Now, this is based on academic studies obviously performed before the current pandemic, and the answers were impressively close. We had an average, I can see, of 82% from the participants who voted in advance. I can see Josh nodding his head. It's not far away at all, but it's still a little low. The average number is 90% of our time spent in buildings. And at the moment, of course, for most of us around the world who are in lockdown conditions, the number is much higher. So I'm going to begin with a brief introduction before we kick off with today's discussions. As I said, I work for the World Green Building Council, which is the largest global membership network dedicated to sustainability in the built environment. We have 70 national member councils active across all regions of the world, working to accelerate ambition to deliver on the Paris Agreement and Sustainable Development Goals, and representing a membership of around 40,000 organisations worldwide. The strategy of the World GBC is to focus on 3 areas of sustainability that we believe we can directly influence. Those are climate action, health and well-being, and resources and circularity. And as you'll see, we're directly aligned to the Sustainable Development Goals that we believe are most applicable for these areas. Now, focusing on the health and well-being work, this is the area that I lead at World GBC. Our global project is called Better Places for People, dedicated to creating a healthier and more sustainable built environment. Now, as part of this Better Places for People campaign, the World Green Building Council launched a dedicated air quality focused project last year, which we called our Air Quality in the Built Environment campaign in partnership with the UN subset, the Climate and Clean Air Coalition. Now, this campaign is focused on promoting a sustainable built environment to mitigate both cause and effect of air pollution, reducing harm to people and planet. Now, within that campaign, we have 4 goals. The first is to reduce the ambient or the outdoor emissions related to the built environment and construction. And we will touch a little bit on that in today's conversation. But of course, the main topic of conversation is around our second goal, the mitigation of indoor air pollution sources. And adding to that, we're looking to promote sustainable building operation and increase awareness and action. And on that action point, the World Green Building Council is committed to increasing access to vital data on air quality worldwide. And we recognise that one of the fundamental challenges of the air pollution crisis is that it is invisible. Both inside and outside of buildings, it's hard to know the health of the environments that we're in, and we need data to empower these decisions. We cannot improve what we cannot measure. As a result, the World Green Building Council, in partnership with Reset, the Earth Day Network, Wilson Centre, and many of our other partners, launched a global air quality monitoring campaign last year called Plant a Sensor, which is dedicated to facilitating the global rollout of in and outdoor air quality monitors and sharing the data on a real-time, transparent, open data platform, which you can see at resetearth.com. And you can find out a little more about the campaign on the World GBC website, including how you can get involved even within your own home, if you should decide to after listening to this session. So of course, we must frame today's conversation within the current climate of being right in the middle of the coronavirus pandemic. And at the time of this webinar being recorded, there are nearly 4 million cases of coronavirus globally, and the death toll is already over 250,000 people. And of course, the point to emphasize is that the cause and the transmission of the disease are not fully known and understood to date. And we are, of course, following the guidance of the World Health Organization and our local and national governments. But what we do know is that for most of us on this webinar, we are spending a great deal of time indoors, particularly in our homes. So one of the angles that we'll be looking at today are the implications for the future of public health. And we're very lucky to have a series of experts to share their knowledge and ideas with us. So I'm delighted to be introduced by 3 expert panelists who we'll hear from in just a second. I'll take a few moments to introduce them. First of all, thank you, Larissa, Josh, and Marcella for joining us today. So Larissa Lockwood is Head of Health and Air Quality at Global Action Plan. Larissa is an air pollution and behaviour change expert, building on 15 years' experience in the sustainability sector. She oversees Global Action Plan's clean air portfolio, including Clean Air Day, that many of you in the UK might be familiar with. It's a campaign that helps millions of people learn about air pollution and take action. Larissa also oversees the Clean Air Hospital Framework, the Clean Air Hub, and the Clean Air Public Insights Tracker. Josh Jacobs next. Josh serves as Director of Environmental Codes and Standards for UL's Environment and Sustainability Division. He's responsible for helping develop codes, standards, rating systems, and purchasing policies around the world. He's a recurring guest lecturer at multiple universities and has spoken on sustainable building practices at many conferences around the world. Josh has served on many, many committees in this capacity, and to name just a couple, he currently serves as Vice Chair of ASHRAE 189.1 and is the incoming chair for the lead steering committee. And last but not least, Dr. Marcella Ucci is an associate professor in environmental and healthy buildings at University College London. Her research focuses on the synergies and tensions between sustainable building design and operation and occupant health and well-being. She is secretary of the UK Indoor Environments Group and co-author of the report from the Royal College of Paediatrics and Child Health on indoor air quality and children's health that was published in January 2020. So it's a pleasure to have you all with us today, and thank you very much to our panelists for being involved. Hopefully you'll have seen our panelists, have been able to see their faces for the last few minutes. We'll be turning off the webcams in a second as we hear from our panelists, as they're going to answer some extended questions to kick off the conversation. Now, a note to our audience, questions are welcome throughout. We want this session to feel conversational. We want to take advantage of the great technology we have. So please do be part of the conversation by sharing your questions. And we've also asked and invited our panelists to discuss and debate with each other. And whether you're joining this session live or via recording, there will be opportunity to continue the conversation offline via email. So let's get started with our first question, which will go to Marcella. As I said, we're going to have 3 extended answers. And Marcella, we'll kick off with you first, if we may.
Yes, hello.
Hello to you. Great, we can hear you and see you. But if we can ask you to kick off, please, can you please explain to us what is indoor air pollution and why is it a problem for human health?
Yes, indeed. So as I do so, I'm trying to move the slides. Bear with us. Okay, so the first thing that I wanted to clarify is that when we talk about indoor air pollution, we should also be clear about what we are referring to. Some experts, when talking about air pollution, primarily refer to outdoor pollution, whereas others, when they talk about indoor air quality, they only refer to indoor sources. So for the purposes of today's talk, I'm going to talk about indoor air quality, referring to indoor exposures to both outdoor and indoor generated pollutants, first of all. Generally, pollutants that are airborne, but traditionally, when we talk about air quality, there are also pollutants that are not always permanently airborne. I have a little picture of the dust mites there. Dust mites don't fly, and their allergens are settled in dust, but these allergens can become airborne through various, for example, cleaning activities, etc. So, wrong way. So the other thing to mention is that there are several pollutants of interest in the indoor environment, and that's important when we consider the health outcomes. I will not cover all of these listed in the slides. I would say that there is a great appendix table in the Royal College of Physician and Child Health report for children and health, where all of these are listed, their sources are outlined. So it's a real kind of useful reference to look up later. The important thing to remind ourselves, which is very important when it comes to identifying solutions for the built environment, is that there can be several sources for the same pollutant. And indeed, sometimes when we monitor pollutants, we cannot immediately attribute source. And as we also know, sources can be natural, can be anthropogenic, indoor and outdoor, as we see examples of pictures for particulate matter. And as we know, as a strong reminder, potent reminder from the COVID-19 crisis, people can be sources of pollution too. For airborne and bacterial transmission, of course, as well as other pollutants such as odors and CO2. So given this variety of pollutants and sources, there is a variety of health effects. The most well-established and documented and understood are those affecting respiratory and cardiovascular health, even though there is evidence emerging of effects also on kind of neurological and developmental systems. We should also distinguish between long-term effects arising from prolonged exposure. For example, prolonged exposure to radon can cause lung cancer, and it is the second cause in the UK after smoking. There can also be acute effects that manifest immediately. Some can be extremely severe, like death or carbon monoxide poisoning. Others can be mild and can be temporary. And of course, it depends on individual susceptibility, or for example, pre-existing allergic condition, pre-existing respiratory or cardiovascular conditions, as well as age. Children and older people are particularly susceptible. And finally, we should remember that those that are poorest and in most disadvantaged groups are often most affected, both in terms of exposure and often also in terms of health outcomes. In terms of estimates, obviously there are different ways of estimating these. This table shows the global estimated deaths due to pollution risks, and it highlights that pollution due to air is far greater in comparison to water pollution or occupational pollution. However, this data is based on worldwide data, and it's heavily skewed by cities which are heavily affected by outdoor haze episodes, as well as by countries where people use, for example, biomass for heating and cooking. This other data, however, is about an estimate of the disability adjusted life years in European countries, and it shows that the burden of disease and of morbidity is heavily influenced by outdoor sources of particulate matter, followed by indoor PM2.5, but also radon, dampness, so on and so forth. And of course, this is an estimate, a modeling study, which relies on exposure, which we don't have very strong evidence on. Finally, a word of warning in terms of air quality thresholds. For some pollutants, there is not enough data yet to establish health-based guidelines and safe threshold levels. On the other hand, for some others, we know that there is effectively no safe level, so the lower the better. And we should also be aware that some thresholds established by World Health Organizations and the like are based on public health consideration and policy consideration, including what's achievable, and are not always transferable to buildings and individuals. Thank you.
Thank you, Marcella. That was a brilliant summary. You gave us loads of information, both what we know in terms of numbers about the air pollution crisis and what we don't know as well, which we can pick up in discussion. So thank you very much. let's prepare now for our second question. We're coming to Josh Jacobs next. So Josh, if we can hear you, I'm sure we can. Josh, we know that UL's mission is to make the world a safer place. And with your organisation's background in indoor air quality that hopefully you'll tell us a wee bit about, can you tell us more about how we should operate our buildings to ensure we're creating safer indoor air for all of us?
Yeah, good morning, good afternoon, good evening, everyone. Again, Catriona, thank you for the question, and Marcella, thank you for setting up kind of our background of where we are. Apologies here right now, just having a little bit of technical issue there. So you're asking about our mission. Our mission is to make the world a safer place, and indoor air quality has been a huge part of that. The question we most normally get is, okay, but how do we end up doing that, like you asked? The detail that our scientists and research have shown that there's three main concepts that you need to focus for good indoor air quality, or IAQ. Number one is proper ventilation, right? Depending on your space, whether you're in a commercial space or residential, healthcare setting, daycare, you need to have the proper ventilation. You don't want to have too much or too little. They can both bring issues in. You also need to have proper filtration, right? You need to make sure that you're filtering out those PM 2.5s, those PM 10s, any combustion type gases that potentially could be filtered out by the special type of filters, while also being aware of the sustainable concerns that we have around energy usage. Obviously, we could all run as much fresh outdoor air as we want, but that would raise our environmental footprint. Excuse me. But the most important one that's detailed by everyone is source control, right? And source control is literally about making sure that we don't bring the problems into the space to begin with, whether that be through low emitting material specifications by looking for certifications like Green Guard, which is UL's longstanding low emitting material certification program. We've got about 49,000 product families in all sorts of indoor products around the world available for that. You want to respond to the site context. You don't want to put an air intake right next to, say, a road where you're sucking in, obviously, combustion gases from outside. And you want to have the right programmatic layout for your ventilation systems and choosing of the products. Again, that's kind of where you start, those three areas for good indoor air quality. But during construction can be a concern as well. Obviously, not a lot of construction going on right now, but when we do start back up, you want to make sure that you're taking care of ideas not to bring those concerns in from during the construction time to during occupancy. One thing you want to do is install wet products before dry products. This is the sink effect concern, which don't want to get too scientific on everyone, but obviously some of our porous materials like woods, ceiling tiles, gypsum boards, insulation, carpeting, these things can actually suck in some of these volatile organic compounds that Marcella mentioned, and they can sit in there and be re-released over time. You want to protect your ventilation units that you have open, so no dust or particulate matter or combustion gases can sit in the ventilation unit over time and be re-released. You want to worry about moisture. Sometimes we talk about all these other things like VOCs and aldehydes and particulate matter and ozone and things of that nature, and we forget about a major concern around moisture and mold issues. You want good housekeeping, certainly. That's just normal every day. Even those of us living at home with the COVID-19, I think we're being reminded how important good housekeeping is day after day. And then when you're done with construction, potentially do a pre-occupancy indoor air quality test with a professional that has done indoor air quality testings for programs like BREEAM, LEED, Singapore BCA Green Mark, Australia Green Star, ASHRAE programs. UL tests about 5,000 indoor environments a year. So some of this indoor air quality testing shows us, hey, we've done something wrong. We've installed something incorrectly. It also helps keep track of things like potentially your commissioned products and things of that nature. Another way during operation, obviously, again, you want to worry about making sure that you're not bringing sources in, especially now where we're worried about ensuring that our indoor environments are clear of COVID-19 or any other potential viruses that we're worried about. You want to clean as much as you can, but some of the cleaners that we bring into our indoor environment can be a problem. right? So you've got a number of these potential chemical concerns on the left-hand side and where they're actually coming in from. You've got chlorinated hydrocarbons coming from cleaners and degreasers. You've got alcohols and aldehydes coming from disinfectants and aerosols from hydrocarbon gases and things of that nature. So again, some of our solutions to our problems can just end up being other problems when we want to clean our indoor environment. Again, I talked about testing a little bit, both being proactive and reactive. You want to have an indoor air quality management plan when you're talking like a commercial level building. Obviously in a residence, hopefully we all have our own sort of mental plans that we have when we're in our residential areas. But in terms of that commercial space, you want that indoor air quality management plan because it allows you to use common sense, right? And you want to be vigilant and you want the entire team to be involved with it. Again, you don't want to overreact to certain things. If you understand you have the right testing organization, they can show you and tell you, okay, this chemical could potentially come from, say, paint that was used to touch up a hallway or something like that. So you don't want to overreact to any results from an IAQ testing. That's why getting a reputable organization is really important. Again, that's qualified professionals and consultants who've done tests, who can prove that they've done these tests, that you know work well in the indoor environment. And again, when you get these reports on the IAQ testing, you want to understand that it fits with any project documentation that you have. Keep it. Understand what's happening over time. Again, as Catriona mentioned, and we'll talk about it in a little bit, I'm guessing, is data is king here, right? So this may be your normal average and what you can do with it in the indoor air quality and measuring some of the VOCs and PM 2.5s and PM 10s. But over time, that some of the changes that you make can impact. Does it go up? Does it go down? And you log that to understand what's happening. Some of the VOCs that we're talking about in here that get brought in from different man-made products or cleaning products or even humans, you see a lot of these things on the list. Formaldehyde being one of the global things that can really impact people. We've kind of understood that this is a carcinogen for a number of years. We use it a lot though, right? It's in a lot of our material. It does exactly what we want, right? And that's great. It glues things together, holds things together very well. It doesn't mean it's automatically bad. It doesn't mean we can stop using things like formaldehyde, but we need to minimize our exposure to these types of VOCs. So if you're doing any testing indoor and you start to see these at potentially harmful levels, that's where you need to start to get concerned. So Catriona, that's it for me. And I look forward to talking with all of you the rest of the morning or afternoon.
Thank you, Josh. That was incredibly helpful. And I think the reminder about the chemicals that we're using in the products in our house when we're also focused on household cleaning is a particularly important one. So good for us to come back to later. But before we get on to that, we have a third expert panelist to hear from. Larissa, we'll come to you now, please, because we would love to learn a little more about your work at Global Action Plan, which, as I mentioned in the introduction, that spans both ambient or outdoor air pollution and also indoor air pollution. And so I think it would be great if you could tell us to what extent are these two issues linked?
Great, thank you, and great to be on this webinar. So yes, indeed, the outdoor-indoor air relationship is a very interesting one indeed. And just before I start, just to let you know where I'm coming from on this issue, Global Action Plan's clean air work is primarily based in the UK, where we work to fuel the clean air movement, working to support the public and organisations like hospitals, schools and businesses to address air pollution. So I'll be coming more from the user perspective. But back to the question. You'd assume that given the media and political attention given to outdoor air pollution, that outdoor air pollution would be worse than indoor air pollution. You might also assume that given that we spend most of our time indoors, as you nearly correctly guessed, 90% of our time indoors, even outside of a lockdown, and given that no one's really seriously talking about indoor air quality, you might assume that it isn't a problem. However, this isn't always the case. So let's look at where outdoor air pollution is coming from in the first instance, with a wonky S. So we've got the nitrogen dioxides coming from road transport, including cars, delivery vehicles, particulate matter coming from domestic burning, such as the use of wood stoves, sulfur dioxide from energy generation and industry, and ammonia from farming and agriculture. Then if we look at where indoor air pollution is coming from, as my fellow panelists have mentioned, we've got the VOCs from the household products, cleaning, personal care, do-it-yourself, furniture, particulate matter from cooking and domestic burning, such as the use of wood stoves, and also nitrogen dioxide from gas stoves. So which is worse? Well, if a building is occupied by people who are not generating air pollution, in other words, not doing anything, like perhaps sleeping with the heating off, then outdoor air pollution is estimated to be worse. It could be 40 to 70% worse outside in this scenario. However, when we are in buildings, we are typically doing something, and buildings are typically occupied by people, and we're constantly doing things that generate air pollution, like cooking, cleaning, heating the space, doing up our homes, and so on. And when we do these things, the pollution levels change. So we've got more pollution being generated inside, and we've got air pollution coming in from outside. There we go. And in the home, there's an additional problem, not just because you've got this outdoor air coming in, mixing with the cocktail of pollutants indoors, but the pollution builds up as it's harder for the pollution to escape or to dissipate in an indoor environment. So we often term this, we're creating a toxic box with a cocktail of pollutants. So how we manage our homes and buildings will therefore have a really important impact on air quality, and is why ventilation is so important, because even with ventilation, it does typically take longer for air pollution to disperse inside than it does outside. And of course, we need to address source control too. So how much worse is indoor air pollution than outdoor air pollution? Well, let's have a look. In the US, indoor air pollution is estimated to be 2 to 5 times worse than outdoor air pollution. And as part of Global Action Plan's Clean Air Day campaign, which is the UK's largest air pollution campaign, we did some of our own research, which I will share with you now. So we worked with an organisation called NAQTS, the National Air Quality Testing Services, who measured levels of ultrafine particles. So these are the really tiny ones like PM 0.1. These ultrafine particles inside and outside the homes of 4 families in the UK, with a piece of kit that can measure both indoor and outdoor at the same time. And we found that indoor air pollution was on average 3.5 times worse inside than outside, and at its peak it could be up to 560 times higher. So this is a graph from one of the homes in from Lancaster. There are a couple with 3 kids. It's a city in the north of England, and a few things stand out to me immediately on this graph. The blue line is indoor levels of ultrafine particles, and the pink line is outdoors. And the first thing that strikes me is those blue peaks. So you can really see just how high levels of indoor air pollution can get. And this was when the family was cooking and when the family lit their wood stove in the evening. What's also interesting is the shape of these peaks. You can see that the pink outdoor ones sort of peak and then drop fairly rapidly, but the blue indoor ones take a much longer time to return to the baseline level, illustrating the point that pollution builds up indoors. You can get more exposure to it because it takes longer to disperse than outside, that toxic box effect. And it's also interesting to see how when indoor levels sort of return to their baseline, when residents are doing very little, so during the sleeping hours, you can see that levels of pollution outdoors are indeed higher, but you can also see the ingress for when there's outdoor peaks. You can also see that the levels do increase indoors as well. Just quickly on another one from a home in London, and what I think is striking on this one is that the levels of pollution are higher, both outdoors and indoors, because levels of pollution in London are significantly higher than in Lancaster. And again, you can see when the building was unoccupied or the residents were sleeping and doing little to generate pollution, the outdoor levels are higher than indoors. But again, we have those peaks for indoor air pollution, which I know when the family cooked their kids' dinner, I think they had sausages in the early evening. And then later on, there's a second one when the adults cook their dinner, and I think they had steak. And again, the peaks show the same thing. It takes longer for air pollution to disperse inside than outside. So what happens when we look at a different pollutant? This was from another piece of research we did as part of Clean Air Day. Again, these are not peer-reviewed studies, but I think they illustrate very well the academic points the others have made. We worked with an organization called Autopia, who specialize in indoor air quality testing, this time taking a deep look at these volatile organic compounds, the VOCs, and in particular formaldehyde. And I'm not going to go into detail on this one, but just to make the point that, you know, while people think that perhaps they can close the door and keep air pollution out, this is far from the case. And this study found that just under half of homes, of the 47 homes audited, just under half of them had unhealthy levels of VOC, and that 28% of those householders did report having multiple respiratory difficulties, and that a fifth of the homes in the study exceeded the safe level for formaldehyde, which, as Josh mentioned, is a respiratory irritant and carcinogen. Including James, pictured here in his new build flat with lots of new furniture. So his home audit suggested that these VOCs, including formaldehyde, were coming from his laminate flooring, his new furniture, his personal care products, and dry cleaning. So the other aspect I wanted to look at, because I think, you know, this cocktail of pollutants inside our sealed homes is clearly a recipe for poor health. But another ingredient in this recipe is the lack of public understanding or awareness around indoor air quality. It's worrying, but it's something that we can do something about. And at Global Action Plan, as well as the campaigning side, we do quarterly public polling on knowledge, attitudes, and behaviours around air pollution through our Clean Air Public Insights tracker. It's all freely available on the website. So CAPIT tells us quarter after quarter that people are less concerned about the impact of indoor air pollution on their health compared to outdoor air pollution. They're also less able to identify health issues associated with indoor air pollution compared to outdoor air pollution. And they're less able to identify effective ways to reduce indoor air pollution compared to outdoor air pollution. So levels of public understanding are much lower. But even when people do understand what can be done to reduce levels of pollution in their homes, there is still a knowledge action gap. So you can see here on the graph, these are some of the levels of people understanding that opening a window is a good way to reduce indoor air pollution is at about 50%, but even then not all of those people who know that it's a good thing to do are actually doing it. And this becomes quite marked on some of the ones further down. So the one that always strikes me is around the using low emission labeled products. So the things that are labeled low VOC. So while about just over 30% of people sort of recognize that they are an effective way to reduce indoor air pollution, just over 10% are actually choosing to use those products. So to summarize, outdoor air pollution is a better known problem, and a problem that is acted on more by both decision makers and citizens than indoor air pollution, yet levels of air pollution inside our homes are often higher than outdoors, because what we do inside creates considerable pollution that mixes with what is coming in from outside. So we have a big job to do to design, build and fit out buildings that pollute less, and also to work with residents and occupants to ensure that they can better manage their own indoor air quality. Indoor air pollution is not on the public radar in the way that it needs to be, and I think that we need to do more. And I'll stop there for now. Thank you.
Larissa, thank you so much. Some really fascinating visuals in particular there. I'd love to spend longer dissecting those graphs that you showed. That was fascinating. Thank you to both yourself and to Josh and Marcella as well for 3 extended intro questions. Now it is time for our panelists to turn their webcams back on, and we'll move into the second half of this webinar. We've got some questions to kick off the discussion now, which are based on what's been coming into the chat box. So I'll kick off with my first question from Marcella, but Larissa, Josh, please come in, and then we'll pick up comments live from the chat box as we go and integrate them into some of the questions that were submitted in advance. So we've had a few people raising their hands to mention the fact that they would like specific design advice. Obviously, we're trying to do this on a global level, but that fits well. We've heard this in the opening comments as well that some people submitted before we kicked off. But Marcella, let me ask you to start, please. What can our designers and practitioners do to improve air quality in the built environment?
Yeah, so I would say 4 things, okay? Know your sources, measure air quality. Remember, ventilation is important, but it's not always done with fresh air, and avoid overcrowding, okay? So in terms of knowing your sources, we've heard about, you know, there are different sources and not everyone is aware of what they are. Remembering that outdoor is also a source and people are also a source. So the spatial location of function within a building is important. For example, putting, you know, printers in areas which are well ventilated and segregated, and also positioning the extract fans of mechanical ventilation when available in corresponding to the sources, and remembering that, of course, sources can be people. In terms of measuring air quality, it's important, of course, to remember that there are some very low-grade sensors available on the market, and nonetheless, they can still be used to study trends, but definitely not to demonstrate that the air quality is good, bad, or indifferent. And we should also remember that some of the most sensors, in fact, will not be able to tell us what the source is it indoor, is it outdoor, etc. There are proxies as well that we can use in homes. So if there is condensation in winter, it's a sign that there isn't enough ventilation, for example. Ventilation not always done with fresh air. A lot of designers, when they size their ventilation systems and air exchange, they do so on the assumption that the outdoor air will dilute because it's fresh, but it's not always the case at all, I'm afraid. If possible, provide windows on different aspects. Avoid at all costs flats with a single aspect because there isn't enough ventilation there. And finally, avoid overcrowding of people, of course, but also because it can, you know, create other problems with overheating, smells, viral load, etc.
So Marcella, that was interesting, actually, what you brought up. Obviously, I agree with all of it. The source control being incredibly important, but you mentioned the sensors, right? Because everyone thinks, oh, you tell me there's a problem, you know, and Larissa's actually showing us the problems with the spikes. I should just buy one of these sensors from, you know, Amazon.com or whoever, and throw it in my house. But like you mentioned, these sensors have traditionally been, at least the consumer level ones, not great. I think all of us would shake our heads and agree not great is a polite way to put it, which is why the Plant a Sensor program, I think that Catriona mentioned at the beginning, is important, because within that, yes, we want more data, right? We want more information from outdoors, from indoors, from our spaces, but that's also why we put requirements on some of the sensors in here, right? It's great to have any data, but as you mentioned, false data or misleading data can lead us down paths that aren't correct. So an example in the Plant a Sensor program that the World Green Building Council is running, we have the UL 2905 standard in there that is actually a new standard around measuring what a sensor can and can't tell you. So hopefully we start to get better sensors on the marketplace. I know certain countries around the world are even talking about requiring sensors in their buildings because they recognize indoor air quality is such a problem. So measuring is important, but measuring correctly, I think, is a key here, because you don't want to go down that path of being misled by, you know, a sensor just beeping in the corner, and next thing you know, you're ripping the batteries out and you're just like, this is useless.
Yes, and if I may add, I think the other one that also goes back to Larissa's point is indoor higher than outdoor. There's a lot of trend in research for personal exposure monitors. So those are monitors where, you know, rather than being static in the room, they follow us and they see what we are exposed to. Those type of sensors give a completely different insight to, what's happening to us, and of course what could happen to our health. Sometimes they show completely different views as to whether indoor is higher than outdoor, and I will not expand on that. But I should say that some scientists are relying more heavily on those than it used to be, and rightly so somewhat.
Thanks, Marcella and Josh. Larissa, I'm going to pass this over to you because you presented us a great citizen-focused angle, particularly with a lot of the campaigns that Global Action Plan runs. And we're getting some questions in the chat box. I'm looking at Neeraj Kumar's question in particular about how can we diagnose those sources that are causing the indoor air contamination if you're looking at the kind of data that you've just shown us, and particularly if we're not all experts out there. Is there anything you can do to shed some light on what the general public can do?
Yes, certainly. So there are things, luckily there are things we can all do as citizens to improve the air quality in our homes. And we run the Clean Air Hub, which is the UK's go-to public information source on air pollution. So there's a range of advice on actions for the public there on both indoor and outdoor air pollution. And the tips are really around sort of protecting health. So they are exposure reduction as well as tackling the source of air pollution. And of course, we need to do both. But in terms of sort of our top 5 tips for indoor air quality, these are taken from the hub. The number one is around ventilation. So it is opening windows or using the extractor fans when cooking, cleaning or decorating. And referring back to my points around outdoor air pollution coming inside from earlier, it is important to think about which windows you're opening and when. So making sure that you're closing windows near busy roads during rush hour and ventilating on the side away from those major sources of outdoor air pollution. Secondly would be around wood burning stoves or open fires, only using them when absolutely necessary. And when you do, making sure you burn well, so using smokeless fuel or dry, well-seasoned wood, as has been mentioned. Thirdly, using fragrance-free, milder cleaning products and using creams rather than sprays where possible. Choosing paints and varnishes that are labelled as low volatile organic compounds, and I'm going to look out for your Green Guard label, Josh. Fifthly, it would be around getting your boiler serviced. And if it doesn't sound too flippant, looking at the grass we saw earlier, try not to burn the toast.
Thanks,
Larissa,
Larissa.
I think the one thing that really shocked me about your data is, you were talking, I think it's 45+% had VOC problems in the surveys that you guys did, which is scary, right? Especially when you're talking almost half of all of us being inside now all the time. But the scarier number to me was 28% of those people talking about that had the higher VOCs were talking about respiratory problems. So we're seeing a direct correlation, right? Marcella certainly, being the doctor among us, can illuminate a lot on it. But I remember multiple studies from Northern Europe, from North America, a couple from Asia, that talked about direct correlation between VOC exposure and to raising asthmatic rates. And as Marcella mentioned earlier, the response of the body, right, and inflammatory response and things of that nature. Even in utero, right, they're seeing some problems where it's crossing the placenta and things of that nature, mothers and stuff like that. So that 28% just, I mean, every time I learn something new, it scares me. So that's a little bit of the frightening part, right?
I think with respect to the health outcomes arising from indoor exposures, especially in Europe, I should say, and the UK in particular, but in other countries as well, there haven't been very recent campaigns of monitoring indoors. So we have very dated data that doesn't reflect the changes in people's lifestyles, consumer products, etc. So it does not reflect the true picture of, exposures. It can be extremely hard, to estimate the burden of disease because some of the health outcomes can be multifactorial. So asthma can be caused and triggered by so many different things. So you need very big sample sizes. So some of these studies end up being incredibly expensive, especially because it's a lot cheaper to put a sensor on the road and then assume that everyone is exposed to the same level. If you have to gain access to people's homes, several, sensors there is a lot more expensive, but it's definitely needed.
Thank you all. I'm going to move you on now. We've got more to discuss, and we're having a lot of comments in the chat box about the fact that we need to bring this into the present and even to looking forwards, because we've talked a little bit about design advice, which is really helpful, but let's put this into the present tense and look at what we can learn from this crisis for the future of public health. Who'd like to kick us off for this one?
I'm happy.
Yeah.
Okay, so yeah, it's obviously a profound and deeply sad moment for humanity right now, but there will become a time when this crisis abates. And in this time, sort of beforehand, I think we really need to ask ourselves if we want to go back to normal, because normal wasn't perfect in many ways. And from an environmental and air pollution perspective, normal was actually quite far from being good. So I think we have an opportunity to create, what's being bandied around as this new normal, but a better normal. And as the Clean Air movement in the UK, we're starting to look at this through a sort of Build Back Cleaner Air campaign. And we're encouraging people to notice the aspects of the current lockdown situation that we've actually liked. Obviously, very few people like a lockdown. I, for one, can't wait to visit a pub again. But there have been positive experiences, and we're capturing these now to try and help build back a new model of life that's better for air quality, the planet, and our health. Because I think, people are telling us that they like the low traffic streets because they can feel the reduction in air pollution with their breathing, less itchy eyes, clearer skin. They're appreciating the clearer skies, hearing birds sing, being able to talk to their neighbour over the road because there are no cars going by. And one of the big things that's happening, the big shift, is this working from home. And I think people are enjoying not having to commute, feeling less stressed by that, are able to go for a run at lunchtime, read a story to their kids every bedtime, every day. So surely we want to hang on to some of these positive experiences that are good for us and the planet. So I think and I hope that home working will become much more commonplace, which obviously has many benefits, but we also need to therefore use this opportunity to look at the home environment. So if we're all going to be sort of sitting in our homes, which I've previously talked about as being toxic boxes every day, we do need people to be more conscious of indoor air quality and of the sources of indoor air pollution. So hopefully, this is the beginning of a conversation around that, and we can use this as an opportunity to address and talk about indoor air quality much more, and use it as an opportunity to build back cleaner air.
Yeah, Larissa, one interesting point you bring up there is, okay, I agree with you, right? We need a shift from what was normal. I don't want to go back to what we were. It wasn't working for most of the planet. So the thing to go forward is, if we are going to be in our homes more, how do we address that? And I know at one point when we were kind of preparing for this, we talked about what do governments do, what are regulations that can come about, and things of that nature. I'll actually point out and give some credit to our West Coast folks here in the U.S. I can't give credit to a lot of the U.S. on a lot of things at the moment, but our folks in California, they have a green building code, right? That's mandatory for residential and non-residential, so commercial and residential. And in the residential portion, they actually have requirements for low emitting materials, right? So requiring things like Green Guard certification in flooring and insulation and things of that nature, gypsum board, paints, adhesives, stuff like that. So there are pockets of people trying to say, okay, look, if you're going to be at home or commercial, we're going to help regulate this for you, right? And that's that carrot or stick, right? Obviously, this is the stick portion, right? The code, you must do. And that's important to raise the bar. But then the carrot side of it are the things like rating systems like BREEAM or LEED or things like that to give credit for it. But I'm really impressed with what the state of California did, especially in the residential scenario, in putting low emitting materials, so source control, in a code requirement. So the base level resident has to have source control in it in California. So it might be something that people want to look at.
Yeah, Josh, I think if I may kind of build on that point, because I think there's been some reluctancy, shall we say, to regulate or even talk about indoor air quality, partly because there is a perception that, for example, in homes, okay, people don't want to be told what to do at home. They also, introduction of labeling scheme is going to affect the market, etc. If anything, I think this terrible crisis has shown us the power of foresight and prevention. We have now understood that at times our private liberties must be coming second to the greater goods. And so this is a moment when I think there is an opportunity to say, actually, for the value of public health, we should look at the introduction of source control. We should look at the introduction of, what's good for individuals as well as homes. The economy, giving priority to the economy only is a false economy in the long term for public health and the economy itself, as we've seen.
Brilliant, thank you.
Agreed.
Now, sorry to cut you off, Josh. We've got about 10 minutes left. We have got so many great questions in the chat box, and we'll try and pick up a couple in these last few minutes. But on screen, we have the contact details for all presenters and myself. If you would like to reach out about anything specific, there are some quite specific questions for one speaker in there. But there's one thing I want to pick up because we have a lot of comments clearly from attendees speaking to us from all over the world, talking about different climates. We've talked a lot about source control, we've talked a lot about ventilation, but these comments keep coming in. Do we need to adapt this guidance for different parts of the world?
Yeah, so I guess my answer is yes, of course. Obviously, different parts of the world have different issues. How much indoor air quality can you bring in Alaska versus Sudan? Those are different concerns. So Marcella's point about outdoor air and Larissa saying outdoor air can be part of the problem depending on where you are, right? So that goes back to knowing where you are. But also, additionally, you have the moisture concerns, right? Singapore has a different moisture signature than the Mojave Desert here in the U.S. Or the Highlands where you are, Catriona, in the UK, right? So again, you have to be concerned with that. Controlling sources is the same all over, in my opinion, right? Unless you have no walls, unless you're living in South Pacific, right, with no wall structure and you're all open air, then you can have, higher emitting sources all you want. Source control, I think, is pretty standard across the board. You want low emitting materials. You don't want combustion gases. You don't want to have air intakes. You want to control for PM 2.5, PM 10, ozone. Some of these major concerns, the VOCs and aldehydes we talked about, but some of the ventilation and the moisture control and things of that nature and filtration, in my opinion, you have to be concerned with where you are around the world because every climate is a microclimate and they each bring different issues.
Yeah, just Sorry, George, just to pick up on that point, I think it's also important to remind ourselves, the climate in terms of, weather conditions, but also, as I said earlier, vulnerable people, disadvantaged groups, they are those that can be more heavily affected, A, by exposure, B, by health concerns, because often their health is poor to start with. And most importantly, they have less means for controlling their own environment. So we have to be very aware of not just saying, okay, the advice is, open your windows or, use hair dryers or whatever. Not everyone can afford it. Not everyone is able to do that. And so really be extremely mindful in the solutions that are chosen about who are we targeting, who are the most vulnerable, in that particular group. How can we help them help themselves?
Really nicely put, thank you. Okay,
and
now
Larissa,
I think we've got time.
Don't burn toast, right, Larissa?
Never.
Good health and dietary advice. Okay, so we've got time for one last quick question. I'm going to come to our panelists for a rapid fire response. I'd like one sentence each, please, a takeaway for our participants today. And this question is going to be, what is the one piece of advice that we can give for the people joining us today to improve their indoor air quality and create a healthier environment? Larissa, I'll come to you first. Put you on the spot, if I may.
Well, I think the point is that you can't just close your door and shut out air pollution. So do find out about sources and do open the windows. I think ventilation in the home is absolutely crucial.
Marcella?
Well, to build on that point, know your sources. Just because it's sold in the supermarket, it doesn't mean it's good for you. Just because it meets the building codes, it doesn't mean it's good enough for anyone.
And Josh?
Yeah, don't burn toast is my big takeaway. I didn't know that before. No, I'm kidding. Source control. They've both said it, and I agree wholeheartedly. Again, to Marcella's point of knowing the labels, VOC free isn't always VOC free. Different countries have different rules and regulations about what zero is, believe it or not. Sometimes 5 is 0 in certain countries and things like that. So trust certification programs. Obviously, I'm somewhat biased, but there are trusted sources out there. Larissa runs some, Marcella is running studies and things of that nature. So trust your scientists on lots of reasons, but specifically on indoor air quality. Trust the science that's out there.
Brilliant. Thank you very much. Okay, so with those pieces of advice, we'll move towards closing the session. So if I can begin by thanking Larissa, Josh, and Marcella very, very much for your time today, for the time preparing, and for putting on formal clothes to speak to us in this webinar during lockdown. It's been a huge pleasure to have you and work with you, so thank you very much.
Thank you.
And to all of you joining us live here, we've had over 300 participants live, and I know we will have many, many more picking up the recording. Thank you very much for joining us and for your questions. We've had literally hundreds of questions, so I'm sorry we've not been able to get to all of them. But as I said, please do feel free to reach out to us directly with anything specific. And of course, you can join us in the next webinar in the Air Quality in the Built Environment series. On Monday, the 18th of May, we'll be having a webinar specially dedicated to air quality in the MENA region, featuring the Emirates Green Building Council. So thank you very much again to our panelists, to our participants, and wishing you all a very safe and healthy day. Thank you and goodbye.